Today we're gonna look at evaluation of managing and controlling pain. Now, let me just give me a minute. Sorry. Give me a minute. So now, guys, when we want to do evaluation, what is it that we write down? What's the term we use to remember all the evaluation issues?
Graded.
Ever graded?
Super graded.
Ever graded. Oh.
Yeah.
Graded.
Joanne is coming back in, sorry. Yeah, ever graded. So, let me try this. Where are you guys? Joanne keeps coming back in. Go away, Joanne. Come on. I've admitted you. Okay, so ever graded. Sorry, it's Joanne. She keeps coming back in and out. Okay, so let me just clear that first. Clear my drawings. So we use ever graded. Ever, please excuse my handwriting. Ever, nope. Do you have your notes with you?
Yeah.
Is it open?
No.
Please open it. Now, okay, what is E? Ethical issues. Now, is there anything unethical in this study? Not in this study, in this topic?
No.
No, nothing that is uncomfortable, that is painful.
The side effect of the
Yeah.
biochemical method.
Yeah, so biochemical method can be considered unethical because it has side effects. So BM means biochemical, biochemical method. Side effects, anything that is painful, that can be uncomfortable.
Yang aspirin, yung punya drawback is gastric irritation, bleeding, and deafness.
Yeah, so that can be under side effects. There's also, is that Joanne? Yes, that's Joanne. There's also acupuncture. What can we talk about when it comes to acupuncture? So AM means alternative technique.
It might injure someone.
Yeah, so in terms of acupuncture, right? So it can be painful or uncomfortable. But what is good about this kind of methods? It's the fact that we have consent. Although it may be painful, it's the participants, not participants, it's the patients who asked for it, who wanted that intervention. Okay, so now, what about validity? Oh, I just asked.
Validity.
Your mic is.
Yes, we cannot hear you.
Your mic, miss.
You mute
You muted.
yourself.
Hello, everyone. Let me repeat that. Hi, everything. Okay, but so anything with validity?
Self-report.
It's
Sorry?
already tested.
Which one?
The
Okay, let's
the cognitive
rewind back.
strategy.
So, sorry. Let me rewind back. So validity. What does validity mean here? That that the method is really validity is when a study is measuring what it's supposed to be measuring, right? So
Yeah.
in terms of this topic, validity means if the method is really relieving,
Effective.
yeah, so effective. Pain. Okay, so which of the method do you think is valid?
The strategy.
Cognitive strategies.
Sorry?
Effective strategy.
Sabrina, can you repeat?
Cognitive strategies.
Cognitive strategy. So it's valid because it really relieves pain based on the result, right?
Yes.
Okay, so the fact that there is a supporting evidence. Now, let's go back to biochemical methods. How does biochemical method relieve pain? Let's say paracetamol.
It can cure back pain or headaches.
By how did they do that?
By closing the pain messages.
Yeah,
Closing
okay.
the
Yeah, so the fact that there is a the fact there is a scientific evidence, the fact that it's scientific makes it, how do I spell scientific, guys? Science. Scientific evidence, yes, scientific evidence. Oh my God, my handwriting. Okay, scientific evidence. Okay. Anything that is low in validity. What alters validity, guys?
demand characteristic.
Okay, demand characteristic. So is there any method that could have been altered by demand characteristics? Let's say for Morley, right? Is there a possibility that the reason they said the pain is reduced because there was demand characteristic that they know they were being studied. So Morley said the patients reported less pain, right? Is there a possibility that this is altered using demand characteristics? So they're actually in pain, but they say, actually, yeah, I feel less pain, but in fact, they are still in pain. Is there a possibility of that?
Yes, yeah.
Yeah,
Yes.
yeah, okay. Now, E,
Ecological.
Ecological
ecological
validity.
validity. Anything with ecological validity? Ecological validity usually has something to do with the setting of the study. So I guess for all of this, the setting is
Natural setting.
natural
because
setting. So we can't do anything. We don't really have much to say about that. So let's move on to the next evaluation issue, which is R.
Reliability.
For
Reliability.
reliability. Okay. Now, reliability in this topic means, does it consistently relieve pain?
Yes.
So which of the method consistently relieves pain?
Cognitive.
Cognitive? What about biomedical?
Biomedical pun.
Okay, so biomedical, it works for everyone. For everyone. Now, as long as you finish your dosage. Now, in terms of cognitive strategies, let's say distraction, or let's say imagery, does it work on everyone?
It doesn't work on anyone.
Or, I mean, you would have to do practices to be able to work it, okay? So cognitive strategies, it doesn't work for, not work for everyone. Not just that, even for yourself, sometimes it works, sometimes it doesn't. So it doesn't really consistently relieve pain for oneself, okay? Not just the fact that they do not work on everyone, but sometimes even on yourself, it doesn't work all the time. Does not work with everyone, or does not work every time. Okay. Next. Generalizability. Anything to do with generalizability? Is there any study there that we can? Not really. Well, I guess we can talk about whether it generalized to all culture.
I guess in terms of biochemical method, it can be for every culture because it works biologically.
Yeah, okay, yeah. So generalizability. Maybe it has something to do with, yeah. Generalizability, BM, all cultures. Which one is only famous in some culture?
Acupuncture.
Acupuncture, yeah. Alternative technique in terms of acupuncture. Okay. Next are
Reductionism.
reductionism. So which one is reductionist?
biochemical method because it only focuses on biological factors.
Yes, so reductionism, biochemical method. Holistic, it focuses on more than one factor. So one method that is holistic is when you mix biochemical method with cognitive strategies.
Alternative technique kan, Miss, yang acupuncture.
That can also be under holistic if you combine a few strategies. Okay. I think this one can be found, this evaluation issue can be found on page 248. So page 248. Under evaluation. Okay. Now, in terms of application, there are two things that you can talk about: application and usefulness. Now, how can knowing this topic be useful?
In terms of cognitive strategies, it can be used for therapy session.
Yes. Effective. How can it be less useful?
It can only apply to chronic pain.
Yeah, so mostly chronic pain. Now, in terms of application, there are a few things that you can, do you see this?
Yes.
Now, in terms of application, it's basically on how practical is it? How easy is it to be conducted? Okay, so drugs, obviously it's easy. You can easily get it from a doctor and it's inexpensive. Okay, easy to be done. However, if we compare it to psychological techniques here, psychological techniques, you would have to spend quite a bit of time with the patient in their consultation, explaining how to do this technique. So basically, there is extra work where you have to work with a therapist on how to do imagery, on how to do distraction, or how to do, what's the third one? Redefinition. Okay, so it's a bit, this strategy is a bit less practical when compared to just giving them drugs. Understand?
Yes.
Yep. So let's go back to the whiteboard. Okay, kejap ah. I just need to. Okay. Sorry, it's just, why is it not? How do I get through it? How do I go to that side, guys? Are you seeing the full screen or are you just seeing, is your usefulness a bit cut off?
Yes.
Yeah.
Yes, okay. I'm just trying to figure out how to do that. Okay, stop sharing. Oh my God. Okay, there you go. Oh, bear with me. Wait a minute. Let me move it here. Okay. Is that better? Can you see it?
Yes.
Yes.
Okay. So in terms of application, practical application, so drug is easy to administer, while cognitive strategies need practice. Okay. So are you okay with application and usefulness?
Yes.
So under application and usefulness, you can already come up with 2 points, one on application and one on usefulness. So E is for
Ethnocentrism.
ethnocentrism, and then D is for
Data.
data. So we can't really do anything about that. Wait a minute. Smile, guys. If nada use if I cannot even see your face. Okay. So now, so those are some of the evaluation issues. As usual, you'll be working in groups. Joanne?
Yes, miss.
Oh, so you've been on mute all this while. Sorry, I think I muted you.
Oh, no, it's okay.
Okay, so you haven't been saying anything. Okay, Melissa, are you there? Melissa?
Yes, miss.
Okay, hello. Okay, how do I stop sharing? Now. Now I'm gonna. Hey, where did my comments go? Now I'm gonna split you into groups. So you can choose which one of the issue you want to talk about. So as usual, you'll be coming up with a paragraph on that issue, and then you will send it to me later or tomorrow. You have until tomorrow to send it to me. Now, you will be assigned to a room soon. So, how many of you are there? 8. So I'll sign into 1, 2, 3, 4 groups. Okay. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Now I'm gonna put you into groups. So I'll give you a minute to discuss which of the evaluation issue you want to do, okay? So basically you just join the group. Okay,
Yeah.
welcome back. So which one are you doing?
Reliability, miss.
Who is that?
Application.
Okay,
Reliability.
who said reliability?
Me, miss.
Okay, so Sabrina and Askina. Sab and Askina.
Because Joanne Thomas.
Joanne, you are with?
Wafa.
You are doing
Application.
application.
We're
Yeah.
doing reductionism, miss.
Who is that? Sarah and
Ifa.
reductionism. That is Maria with Melissa.
Validity.
Okay. Well done, guys. How was that little meeting in your own room?
I didn't
Cool.
Okay. Now, so that is due tomorrow. You can either email it to me or WhatsApp it to me. Okay?
Okay, Miss.
Miss.
Thank you. Any questions?
No.
No.
Okay. See you.
Miss.
Yeah.
Thank you, Miss.
Thank you.
Thank you, Miss.
Thank you, Miss.
Thank you.
Thank you, Miss.